Introduction. A stroke is a serious medical condition that happens when the blood flow to a part of the brain is blocked or reduced, stopping oxygen and nutrients from reaching brain cells. This can lead to brain damage, disability, or even death. Stroke is one of the leading causes of death and long-term disability around the world. It can happen to anyone, but it is more common in older adults and those with certain health conditions. In this video/presentation, we'll explain what stroke is, its types, causes, symptoms, and how you can prevent or respond to it quickly. Don't forget to like, share, and subscribe for more health tips. If you have questions or thoughts, drop a comment below. 2. Types of stroke detailed. 1. Ischemic stroke. This is the most common type, making up about 87% of all strokes. It occurs when a blood clot or other blockage stops blood flow to the brain. There are two main types of ischemic stroke. Thrombotic stroke, a blood clot thrombus, forms in one of the brain's arteries. Embolic stroke, a clot or debris forms elsewhere in the body, like the heart, and travels to the brain. Causes: high cholesterol, atherosclerosis, irregular heartbeat, like atrial fibrillation. 2. Hemorrhagic stroke. This occurs when a weakened blood vessel bursts, causing bleeding in or around the brain. There are two main types. Intracerebral hemorrhage, bleeding directly into the brain tissue. Subarachnoid hemorrhage, bleeding in the space between the brain and the thin tissues covering the brain. Causes: high blood pressure, aneurysms, head injury, overuse of blood thinners. 3. Transient ischemic attack, TIA, mini stroke. A TIA is like a stroke, but the symptoms are temporary, usually lasting a few minutes to hours. It happens when blood flow to the brain is briefly blocked. It doesn't cause permanent damage, but it's a warning sign of a possible future stroke. People who experience a TIA should seek immediate medical attention. 3. Causes and risk factors of stroke. Stroke doesn't happen without a reason. Several health conditions, habits, and lifestyle factors can increase a person's risk. Some are controllable, while others are not. A. Main causes. 1. Blocked or narrowed arteries, ischemic stroke, caused by blood clots, plaque buildup, atherosclerosis, or other obstructions. 2. Ruptured blood vessels, hemorrhagic stroke, caused by high blood pressure, trauma, or aneurysms. 3. Temporary blood flow blockage, TIA, often due to small clots that dissolve on their own. B. Major risk factors. These increase the chances of having a stroke. 1. Medical conditions. High blood pressure, hypertension, number 1 risk factor. Diabetes, high cholesterol, heart diseases like atrial fibrillation or heart failure. Obesity, previous stroke or TIA. 2. Lifestyle factors. Smoking damages blood vessels and increases clot formation. Excessive alcohol use. Lack of physical activity. Poor diet, high in salt, sugar, and unhealthy fats. 3. Non-modifiable factors. Age, risk increases after age 55. Gender, men are more likely to have a stroke, but women are more likely to die from it. Family history of stroke. Race and ethnicity, higher risk among African, South Asian, and Hispanic populations. 4. Symptoms of stroke. Recognizing stroke symptoms early is critical. The faster a person gets medical help, the better their chances of survival and recovery. Use the acronym FASD to remember the main signs. FASD warning signs. F. Face drooping. One side of the face may droop or feel numb. Ask the person to smile. Does one side droop? Arm weakness. One arm may feel weak or numb. Ask the person to raise both arms. Does one drift downward? S. Speech difficulty. Slurred or strange speech. Ask them to repeat a simple sentence. Can they speak clearly? T. Time to call emergency services. If someone shows any of these signs, call for help immediately. Other common symptoms. Sudden numbness or weakness in the face, arm or leg, especially on one side of the body. Confusion, trouble understanding speech. Trouble seeing in one or both eyes. Dizziness, loss of balance or coordination. Severe headache with no known cause, especially in hemorrhagic stroke. Difficulty walking. Important note, stroke symptoms can appear suddenly and vary depending on the part of the brain affected. Even if symptoms go away quickly, as in a TIA, it's still a medical emergency. V. Diagnosis of stroke. When a stroke is suspected, immediate medical attention is critical. Doctors use a combination of exams, imaging tests, and lab work to confirm the diagnosis and determine the type of stroke. 1. Physical examination. The doctor checks for signs like weakness, numbness, confusion, vision problems, and speech difficulties. Blood pressure, pulse, and neurological responses are evaluated. 2. Brain imaging tests. These are essential to determine if the stroke is ischemic, blockage, or hemorrhagic, bleeding. CT scan, computed tomography, fast and widely used, detects bleeding or large clots in the brain. MRI, magnetic resonance imaging, shows more detailed images of brain tissue, detects smaller strokes or earlier damage. 3. Blood tests. To check blood sugar, clotting speed, infection, and other vital functions. Helps rule out other conditions that mimic stroke. 4. Heart and blood vessel tests. Electrocardiogram. ECG checks for irregular heartbeat, like atrial fibrillation, which can cause clots. Echocardiogram. An ultrasound of the heart to detect clots or heart abnormalities. Carotid ultrasound. Looks for narrowing or blockages in the arteries that supply blood to the brain. Fast and accurate diagnosis allows doctors to begin the right treatment quickly. Time is brain. 6. Treatment options for stroke. The treatment for stroke depends on the type of stroke, ischemic or hemorrhagic, how quickly the person receives medical care, and the severity of the stroke. 1. Treatment for ischemic stroke, block blood vessel. Goal: restore blood flow to brain as fast as possible. Clot-busting medication, TPA. Tissue plasminogen activator must be given within 3 to 4.5 hours of the first symptoms. Breaks up the blood clot and restores blood flow. Mechanical thrombectomy, a procedure where doctors use a catheter to remove the clot from a large blood vessel in the brain. Most effective within 6 to 24 hours of symptom onset in select patients. Blood thinners, anticoagulants or antiplatelets. Prevent new clots from forming. Examples: aspirin, warfarin, or newer drugs like clopidogrel. 2. Treatment for hemorrhagic stroke, bleeding in the brain. Goal: control bleeding and reduce pressure in the brain. Medications: to lower blood pressure, to prevent seizures, to counteract blood thinners if the patient was on them. Surgery: to repair ruptured blood vessels, e.g., clipping an aneurysm, to relieve pressure caused by bleeding. 3. Rehabilitation after stroke. Recovery takes time and support. The goal is to regain lost skills and independence. Physical therapy helps with movement and strength. Speech therapy helps with speaking, understanding, and swallowing. Occupational therapy helps relearn daily activities like dressing or cooking. Psychological support helps with depression, memory, or emotional changes. Quick medical attention saves lives and can significantly reduce long-term damage. Stroke survivors often need long-term support to recover fully. 8. Conclusion. Stroke is a serious medical emergency that can have long-lasting effects on a person's life. But the good news is that stroke is preventable and treatable. By understanding the different types of stroke, recognizing the symptoms early, and acting fast, we can significantly reduce the impact of this condition. Additionally, controlling risk factors such as high blood pressure, diabetes, and lifestyle habits like smoking and diet can help prevent stroke. Remember, time is brain. The sooner a stroke is treated, the better the chances of recovery. Education, prevention, and early intervention are key in reducing the number of strokes and improving the quality of life for those affected. By adopting healthier habits and staying informed, we can all reduce our risk and live healthier lives.